Alright, so now we're going to work on the knees. So knees are pretty easy. And so a lot of just going straight in, we're going to check the muscle here, bend your knee. So we'll check the quad. Okay, good. So we'll check both sides. Push up here. Okay, good. And bend your knee. Turn your foot in for me. And resist. So we're checking for rotation of the tibia. That's mostly what I check for first. So you can palpate it too. You can feel for range of motion. It feels a little stuck. Yeah, it moves well, going internal, but externally it feels a little stuck. Okay, and so we can take any strong muscle. I'm just going to use this one though, but we can take any strong muscle, internally rotate, and resist here, and it goes weak. Externally rotate, that's fine. Internally rotate, shuts down. Okay, so that tells me it's stuck in internal rotation, so we're going to externally rotate it on your knee. And there's two ways to do this. We can take our hands and rotate, like just tissue pull externally. Use this to create a force to drive in with my elbow, okay? Or I could take a forearm here and I could drop in like this, okay? And you want to bring it to tension all the way in, okay? So I'll do with the forearm here. So we're just going to bring it in, and then it's a body drop just like the other one. Yeah, and that was a really nice adjustment there. How'd that feel? A little bit of pain, but it felt good, right? Okay. So, oh yeah. So that's the other thing. You usually tell the patient it might hurt for a second. Okay, a little sting. Okay, push here, resist. But you see how much stronger that is now. Okay, hold this here. Awesome. Okay. Okay, so we'll check this knee now. Bend your knee here. Is this here? Good. Turn this way. Turn all the way out. Okay, so this is great. She's got external on the other side. Okay. So we're gonna do the opposite now. So we're gonna internally rotate, and I'll use these as the adjustment. I'm gonna use my hands. So I'm gonna use my hands to internally rotate, and then I'm gonna drive in like this. Okay, so we got that. Nice.
Thanks, sir.
Bend your knee. Turn your foot out. Resist. Sweet. Okay, so that's most of the time. Most of the time that we have issues with, but I totally forgot to tell you the muscle to check is actually the popliteus. So resist here. So people do this differently, but I don't think it to be that specific. Just basically bring the foot into intro. Try not to have them cheat with their toes. Maybe point down a little bit, resist. Okay, hold this here, resist. Okay, good. And then push out here. So you check both external, internal, and that's pretty good. So you can check those before and after. It was probably weak before, but we skipped that step. So, but you can check the popliteus. And then the next thing I check for is the patella. Okay, so in terms of the patella, you can feel how it moves, how it glides, and it seems like pretty good. So this takes a little bit of practice, because what if they're both bad? Then you don't know, so you have to, if you feel normal, you can get a sense, but it feels like they're both a little bit stuck inferior. But with the muscle, you take a strong indicator muscle, resist here. Yeah, and then I can move it this way. I can just challenge any direction, and it seems fine. But if this went weak, let it go weak. Yeah, if it went weak, then I would distract, pull up as much as you can. You can pull up and then just drive in with the web contact on the patella, or you could take an activator and just click on it. But you can challenge every direction, okay? But hers seem fine.
Is there a direction that you find that they're more likely to be out of line?
Probably inferior. Yeah, I'd say most of the time it would be inferior. Okay, so, okay, great.
Thank you.
You're welcome. And I'm gonna have Monica come back up here, because she had a unique case. So bend your back face up, yeah, because she had, what happens is the patella, the tibia can actually go, let's move this up. So the tibia can actually pop in. So she could have fallen, what she did, fell on her knee, the kneecap, and it pushed the tibia. And so instead, this goes like that. And so then that means that this portion is sticking out. So we can see if that's showing up. Okay, so hold this up here, resist. Yeah, so it is showing up. So basically if I pushed here, in terms of the challenge, she wanted that. And if I also pushed in the back of her knee here, that didn't work, that didn't show up. But when I put stress or pain in this area, then that goes weak. Okay, so I'm holding this bone into a posterior position. Okay, so we're gonna basically set it up like this, and then so you bring the foot into flexion, and then take the thein or the piezoform contact, and you just get on both ends here, and then you just drop. So you could use a drop piece if you want to be more gentle, or you can just do it with your hands. Okay, just like that. And you might as well check this side. So hold this arm up. Okay, so she might also have this here. Yep. Okay, so relax. Yeah. So you usually tell the patient it might sting for a second. Is that okay if I put some force here? Okay, good. And then we can recheck it. Good. Yeah, nice. So that's would be for I guess it's a little tricky, but for a tibia that has popped posterior in the proximal end. All right, thank you. So that concludes the knee.